there's something we really need to be cognizant of as nursing professionals with working with these types of patients with leukemia is neutropenia. Neutropenia, of course, is not a disease in itself. It's certainly a syndrome. It's considered a syndrome, not a disease. It can be drug-induced or it can be hematologically due to a hematological disorder. Most definitely, it's a decrease in neutrophils, which is the most significant infection fighter in our body, is the neutrophil part of our white cell count. Counts below 1,000, they say you're at a greater risk for infection, mostly profoundly so below 500, but you're still at risk between below 1,000. Neutrophils are normally 1.5 to 8.0 or 1,500 to 8,000 per millimeters of mercury squared, not squared, but times 3, I should say. Anyway, so that's what you'll see on a normal is 1.5 to 8 or 1,500 to an 8,000. With these leukemias, you're going to have a lot of immature WBCs, a lot of blast cells, which causes quite a bit of immunosuppression in our patients. And this, again, is a major side effect of the chemo, but the most common cause of death in leukemia patients is sepsis. It's the infection just it rages in their body. We can't get it under control, and they die from sepsis. So, biological response modifiers are real good in helping that process along. The BRMs can stimulate the bone marrow production of immune cells. Now, these are expensive, and many of them are not covered by the patient's insurance, so that can be a problem. Examples of these to help the immune system, BRMs, would be proleukin and interferon alpha. Also, of course, we're going to use antibiotics, gentamicin, tobramycin, penicillin, Keflex, any of those anti-infective drugs. Vancomycin is a large hitter especially for MRSA and people who have potential infections of their central cath. Most all cancer patients will have some sort of central catheter, and that's why we have to be very fastidious in how we take care of it and how we clean the ports and how we change the dressings for these patients. Antifungals can be given, especially with patients with neutropenia, because they're more susceptible to that. And so you'll see drugs like nystatin and diflucan given, and antivirals. Anticyclovir can be given at the onset of chemo for these patients. So these medicines are helpful, but they have very serious side effects, these antivirals, like nephrotoxicity and ototoxicity. And there's many other kind of alternative theories like echinacea and vitamin C. They have found some improvement can help with their immune system as well. Okay, so the health team care responsibilities, of course, is hand washing. We have to not know and go back to understand how we do that well. I think after we graduate, we think, oh, well, hand washing, I can do it. But we need to think about how long you need to wash it, how you wash your hands to get the most microbes off when you're dealing with these kinds of patients. So our number one goal is to protect the patient in the hospital and then also protect them in the home setting as well with good education and on when to look for signs and symptoms that they should go to the emergency room immediately, because this is considered an oncological emergency, and how to take care of their central line at home and how to be fastidious in preventing infection there as well. You want to do a total assessment at least every 8 hours on these patients. More often if they're showing symptoms of any kind. We're going to look at their skin, in their mucous membranes. We're going to look in their head, ears, nose, and throat. And we're going to be looking for changes in cardiopulmonary in that, are they coughing? Have they got pleural drainage? Do you hear wet lungs with crackles? Are they, as far as GI, we're looking for vomiting, we're looking for diarrhea, we're looking for those things. We're looking for urinary infections and kidney infections that could set them up for sepsis. Central nervous system, meningitis, things like that. We're going to be looking at those types of symptoms and musculoskeletal. We're going to be looking at bone pain. We're going to be looking at infections there as well. So we want to be sure that we're wearing the correct PPE and that we are using very aseptic technique, that the patient is definitely in an isolation private room, and it would be what? Reverse isolation, reporting of problems of anything. We need to educate on that. Rapid response, again, they should need, when they go home, they need to know how fast to get to the ER, not to play with any of that, and also our rapid response. And delegation of duties. These patients are not something you're going to delegate out to unlicensed personnel, or if they're your responsibility, you want to be able to do all this assessment and everything. I would say that you really need to educate, even though, or remind your unlicensed personnel that any change in temperature for these patients is significant, and it needs to be reported immediately. Of course, again, you would be looking for that and asking what was the temperature when you know it's time to get the temperature, and be sure to educate them. Please let me know of any other symptoms that you may see. And with all of this too, they may still have some thrombocytopenia, they may have some anemia that you would need to discuss as well. Okay, so they can be at a bleeding risk, and we're going to monitor, of course, their blood levels for this. We're going to look at their platelet count, and the platelet count, of course, the normal is 150,000 to 400,000. With these patients, it can be less than 10,000. An increase in the risk of bleeding can be seen at less than 50,000, and a spontaneous bleed can happen after 20,000. So if their platelet count's below 10,000, then they're at very high risk for hemorrhage. We're going to be assessing them very often, getting abdominal girth measurements on them. We're going to be checking for bodily fluids, for blood. We're going to be very gentle in handling these patients. No venipunctures or injections of these patients. So we're going to be using that portacath. We're going to be drawing blood from that, or the central line, whatever they have in. We're going to, when we absolutely have to, we'll have to use the smallest gauge needle possible. We want to avoid trauma to the mouth, nose, or rectum. And we may have to be giving platelet infusion. And the BMR that you would give to help stimulate these cells would be Numega. So that would be a growth factor that would be used to help them stimulate those cells. Fatigue is another nursing diagnosis that you may see. So we're going to be looking at the nutritional therapy for these patients. We want small, frequent meals, high protein and carbs is what we're going to be feeding these patients. And many of them will not have an appetite at all, so anything that we can get them, say it be a milkshake, anything that they can eat, would be what we want them to have, to just get the calories in lots of times. We can do some packed red blood cells also for the anemia. Drug therapy, or the BRMs, can be Epigen and Procrit for these patients. And we're going to have energy management. In other words, we want to have them have little activities, and we want them to have many rest periods as well. So we may want to postpone or eliminate any activities if they're going to go for diagnostic tests, because that's going to just wear them out as well. So altered nutrition is, again, we want to give anti-emetic drugs. Zofran is usually the drug of choice. High calorie, high protein, high carb diets. Supplements such as Ensure, low bacterial diets, we will give them. That would be no raw food, anything like that. We would be giving them their favorite foods just to help stimulate their appetite. And then TPN, total parental nutrition, may be required. But most definitely, we need to watch out for these patients we don't want any kind of flowers, real flowers in the room when they have neutropenia. We don't want them to have anything sitting in water, like dentures and things like that. So all of that is covered under your neutropenic part of your book, so you need to read and be up to date on that.